Thank you very much, Dr. Andera. Good morning, ladies and gentlemen. I've already greeted the minister earlier. I must first say that your world map is very interesting about the distribution of HIV. Now, if you put the world map on the distribution of universal coverage, you'll find that we are also a little stick there, because the world as a whole is going towards universal coverage because we believe at the Hospital Association that is a sensible thing to do. People get surprised that in the private sector, at the Hospital Association, we say that it is sensible to do. Experience has taught us, and I always pride myself and brag to South Africans to say that South African private hospitals are the most experienced units in terms of working in a national health insurance setting. This because, yes, we work in the UK, we work in Europe, where we've got significant activities. Let me come back also and say congratulate the African Leadership Initiative and the African Institute for Health and Leadership Development for having the vision for the need to develop and nurture a common national strategic agenda for health in the Republic of South Africa. People should understand that national health insurance does not mean no private health care. The minister showed you a map here where there is existence of even in those countries where there is no redness, there is still private health care there. There is a mechanism of payment that we are talking about. Dr. Mahlati, you said something telling when you talked about rivers when you were here. If we go back to 2009 and remember what the authors of the Nukeng scenario wrote for us as South Africans, I think it is important to remember that the only way to walk is to walk together. We cannot walk apart, we cannot walk behind. Because if we work together, if we walk together, the state can only be an enabler. The state can be catalytic. The state can collaborate with all the minds that are in the country for good of all citizens. The state will consult. The state will engage citizenry. And therefore, an engaged citizenry will share responsibility for policy outcomes. Because this is our South Africa. We all will suffer if we don't contribute positively to the direction that we have to take. South Africa is a very interesting country. In 2007 late, there was a call by Dr. Zweli Mkhize for healthcare activists to gather at the DBSA. The minister referred to this activity, where for 8 months a document was developed called the Roadmap to the Transformation of Healthcare in South Africa. It was a very interesting period for some of us because private sector, public sector, NGOs, unions, universities, government workers, people came together to talk about what's wrong with our healthcare. And many of the problems that were identified at that point were brought into the 10-point plan. And also one of the most important things, and that is why those people who sit here and blame the problems in the public healthcare sector to the private sector have missed a point, because those hundreds of people who gathered there finally said, these problems don't come from the private sector. There are inherent problems in our system, but they don't come from the private sector. Now, this gathering was comprehensive, systematic, and it reviewed all the country's health systems. And I said to you, and the minister has also said it, that the 10-point plan learned from this activity. Actually, many of the issues that came up that are in the 10-point plan came from there. So, Mr. Minister, the private sector also owns the 10-point plan. It is not a Department of Health plan. It is a plan by South Africans to transfer healthcare, and we consider ourselves part of that process. Now, the 10-point plan talks about leadership. And nowadays, we've always been talking about stewardship. The Hospital Association has always said we recognize the stewardship of the Department of Health. Now, stewardship, I'll repeat as I've said in other platforms, comes from biblical times. It means you're a shepherd. Now, you cannot shepherd things that you hate. Therefore, for the first time in this country, we have a chance of working together and not hating each other. I have lived through, since democracy, ministers who actually hated. They told you they hated private sector. They would actually not even accommodate a discussion about the private sector. There are people who worked in the Department of Health who would tell you that if they were seen with sitting and talking to somebody from the private sector, next they would be asked, what were you talking about? So we acknowledge and recognize the leadership of the Ministry of Health. We see ourselves as part of, subjects of, if you want, as headed by the Department of Health or whatever health leadership is in the country. Because it is only when there is such stewardship that the working together can work, that the contribution from all of us can also work. Because if you don't accommodate us, you hit us on the knuckles, we cannot participate. So, but we do want to participate, and we have participated, as I said. In terms of the NHI, we have always said that it is the most progressive thing that is going on here. The only thing that it needs is that it must be a South African. There's no NHI in the world that looks the same as the other. All countries have their NHI, and each one of them is different. And that is why we are contributing to the type of NHI that we think is relevant to our country. We have actually contributed a lot in the green paper. We have presented our positions. I don't want to go into detail. We know what issues are in terms of pricing, and we are prepared that those discussions must be gotten into, so that when finally the NHI comes, there are established governance processes. And we can learn from the best in the world as to how they have done it. But it has to be homegrown. We have always said also, as the private hospital sector, that the only thing that it needs for us to establish governing institutions on the NHI and even the Office of Health Standards and Compliance is independence from political influence. And I'll stress this, because if a body like that is not independent from political influence, there might come a different minister who's got a different agenda. It does not mean if you are from the same party, then you have the same agenda. We've seen ministers from the same party, from different departments, who think differently. Therefore, to safeguard all of the nation, we need to have bodies that are independent of political influence. We have to have bodies that are informed by science in terms of their decision making, and they must be transparent. And in most countries where such regulatory bodies are functioning successfully, it is because they observe those tenets. In terms of how we see our role in the NHI as a private hospital sector, we are ready for it. We are prepared to work with those who want to enhance it. We are prepared to provide our services to government as we provide our services to other governments outside South Africa. How can it be that some countries of the world recognize our services, whereas our own home country does not recognize our services? We also say there might be delinquents from amongst us. That is why this stewardship is important, so that the leadership can sit with us and say, this is not right, we don't think this is right, we don't think, and together we must develop a way of governing for the good of the nation.